But let's turn to someone from the British Society of Paediatric Dentistry. Professor Claire Stevens is joining me on the line right now. Welcome, Professor. Thank you very much indeed for being there. This situation that we're reporting on from Bristol, are you hearing it's nationwide, there are shortages?
Yes, absolutely. This is a nationwide problem. We have a crisis in children's oral health. And yes, there are some parts of the country which have been termed dental deserts, where it is impossible to get access to NHS dental care.
What is your understanding? What's your take on why colleagues are not practising in so many surgeries up and down the land?
Well, they are practising, but they're not taking on NHS dental patients. And I think you've covered it in your interview just now. The dental contract is not fit for purpose. It does not work for children. It does not pay NHS dentists to provide the care that they want to be able to provide, particularly for the most vulnerable groups in our society. So any plan that doesn't commit to dental contract reform is essentially political gesturing.
Okay, what is the extent of the reparations here, or what changes would make a difference? This £20,000 bung just to go and work in an area where there are fewer dentists is one measure the government say might help. What would you recommend?
Well, first of all, we need a radical rethink about how we consider dentistry and oral health services. We need to rapidly invest in preventative services, so looking at what actually will prevent the dental disease occurring rather than a reactionary service that tries to treat it once it's already established. So any plans that include children's oral health need to have targeted interventions with the parts of the population that are at highest risk, and then a gradient of support thereafter, so that every child is able to access preventatively focused dental services from a very early age. So that would require a change in the way that the dental budget is allocated. You talked about the £400 million underspend. That needs to be ring-fenced. It needs to be protected, and then it needs to be spent in a different way so that vulnerable children and vulnerable adults are cared for in a system that appropriately meets their needs.
I don't want to be facetious, but targeted interventions, is that a way of saying clean your teeth regularly?
No, a targeted intervention is identifying the children that are most in need. And we know, we have really good evidence as to what those children look like.
Why doesn't every child... Sorry, let's start at the very beginning here. And forgive me if this is naive. Why don't all children clean their teeth? What's the problem?
So it's far too simplistic to address it like that. You can't brush away a bad diet. It is a wider societal problem. It's about the sugar content in food. It's about clear and consistent labelling. It's making sure that children are able to access the resources they need. And in a cost of living crisis, that's becoming increasingly challenging for families. So let's not get into the state of blaming children's parents and, well, indeed children and young people themselves. We need to make sure that we have a blanket of support around our most vulnerable children. And that does include things like supervised toothbrushing, which is included in both Labour's plans and is also mentioned in the Conservative plans we see today. But it's also about them being able to access services and making sure that those NHS practices are there where every vulnerable member of our society wants to access them. It's far too simplistic to say this isn't about children brushing their teeth. It's about wider determinants of health. It's about children growing up in poverty. It's about children not being able to access a nutritious diet. It's about increasing access to free school meals. It's far too simplistic to say children aren't brushing their teeth.
Thank you very much indeed. I understand. Just on the how you might achieve that, it seems like you're making a cri de coeur here for more joined-up thinking, that the various bits of the NHS or the health and welfare of the nation should join together and try and do something that will help everyone.
Yes, absolutely. I absolutely am recommending that, because I think everybody has a responsibility to improve children's oral health. It's not just a dental problem. This is about every time a child sees a health visitor, they should be supported in having those oral health conversations. And they are great champions for children's oral health. It's about putting toothbrushes and toothpaste in most children's centres so that the resources are there for the right families to be able to access them. It's about ensuring that paediatricians consider oral health when they've got a child that's in hospital with a temperature of an undefined cause. It's about, absolutely, as you say, joining all parts of the system so that we are all working to improve children's oral health. Government have a part to play, parents have a part to play, dentists have a part to play, industry has a part to play. We are all responsible for children's oral health.
Professor Claire Stevens, thank you very much indeed for spending a few minutes with us, a spokesperson for the British Society of Paediatric Dentistry.
Where the news never stops. LBC News.